Hi there, it's me, Betty Wetter again. Be sure to check out the first of its kind virtual nonprofit exhibition hall and our virtual vendor village, all powered by Event Hub. These two virtual areas allow you to browse and interact with our nonprofit and community partners, as well as vendors of interest to our LGBTQIA community. Here, you can learn about community services and engage with the booth hosts in real time via video chat. You can even make purchases from many of the booths. To access the virtual nonprofit exhibition hall and virtual vendor village, simply click through on the Whova app.
Hello, everyone, and happy Pride. I'm Katie Holtzquist, and I'm Outright Action International's West Coast Director. My pronouns are she, her, and hers, and I'm speaking to you from my home in Seattle. Shout out to Hillman City, Rainier Valley, where I've lived for 20 years with my wife and 3 kids. I'm joined today by 2 of my Outright colleagues, and we're very excited to be a partner with Seattle Pride and to join you virtually for this year's celebration. We're excited to share some of Outright's recent work and what's happening around the world with you, but I wanted to start by inviting my friends and colleagues, Ami and Kennedy, to introduce themselves first. Ami and Kennedy?
Great. Thank you so much, Katie. Hi, Seattle. Happy Pride. I'm also in Seattle in the Central District / Madrona, lovingly called Lesser Madrona. And we are really happy to be with you today. My pronouns are she, her. I've been affiliated with Outright Action International for about 12 years, first as a member of the board of directors and co-chair of the board, and now I work as a consultant research advisor and worked very closely with the team on the report we're about to share with you. Thanks. Kennedy?
Sure. Hello, Seattle Pride. It's a pleasure for me to be joining you all the way from Belize. Kennedy Carrillo, non-binary, he, she, they. And I'm the Caribbean researcher with Outright Action International, living in Belize with my wife and our daughters and a 2-month-old grandson that is running my life. Happy to be here.
Sounds familiar. Thanks, Ami and Kennedy. Before we get into our discussion, we wanted to start by acknowledging that Pride Month is a time to remember the history of our movement, to commemorate our achievements and our creativity and resilience as a community, and to push for social change. And in that context, we want to recognize the history of Pride as a protest led by lesbian and trans women of color, and to state unequivocally that Outright is committed to affirming Black lives and fighting against racial injustice and white supremacy around the world and in ourselves. We believe there is no place for racism in the LGBTIQ community or anywhere else. And in fact, the fight for racial justice is an integral part of our movement for LGBTIQ human rights. We're also grateful for the opportunity to share how our movements for justice and equality here are linked to our global movement. So I'm going to share some slides that we've prepared with all of you. And just like to start with a little bit of an introduction about Outright for those who have not heard of us before. During our presentation discussion, we'll share a little bit about our work in general and the state of LGBTIQ rights globally, but we're going to spend most of our time talking about how COVID-19 is impacting LGBTIQ people around the world and how Outright and our partners are working to address that. But let me start with a more general overview. Outright has been defending and advancing LGBTIQ human rights and equality globally for 30 years. In fact, this year is our 30th anniversary. We're headquartered in New York City with staff and board members on 5 continents, including in Asia, Africa, the Caribbean, Europe, and North America. We have 3 primary programs and strategies for our work. The first is research. We know that having data and evidence about the realities and experiences of our communities and the issues we face is critical, but it doesn't exist in a lot of places. And so Outright has always documented human rights abuses, and now we do research which often involves large global mapping studies looking at issues facing our community, like so-called conversion therapy, the legal registration of LGBTIQ organizations around the world, digital censorship, and the impact of COVID-19, which you'll hear a little bit more about today. The second thing we do is movement resourcing. This is supporting our grassroots movement around the world by providing training, technical assistance, and sometimes funding to grassroots organizations and leaders globally. And third, we conduct advocacy. In particular, we conduct advocacy at the United Nations, where we hold governments accountable. We do this as the only US-based LGBTIQ organization that has what's called ECOSOC status. It's a consultative status and access to be at UN headquarters in New York. We have 2 full-time staff members that are focused on the United Nations, and there we also coordinate the activities of the LGBTI core group, which is a group of 32 member states that are committed to advancing equality. Everything that we do at Outright is through partnership, whether at the UN, with our grassroots partners, with companies, with individual supporters and volunteers, and with local organizations, even here in Seattle. And on that note, I just wanted to say that I think Ami and I are especially proud that Seattle is our West Coast home base. We're both here, along with 3 of our board members, Derek Brown, Jeff Natter, and Louise Chernin, and we have hundreds of beloved friends here. We often co-create educational programs with local partner organizations like Equal Rights Washington, the Pride Foundation, Utopia, Entre Hermanos, GSBA, and many others. And we do this because we believe in the principle of solidarity, that we must stand in solidarity with local and US allies and movements, and we ask them to stand with us and our partners in global work. So now I'm going to turn it over to Ami to share a little bit more about the state of LGBTIQ human rights globally and the impact of COVID-19.
Thank you so much, Katie. Yeah, before we get into the specific findings of the work that we did, the research we did to evaluate the impact of COVID-19 on LGBTIQ people around the world, I think it's really important to understand what sort of the backdrop is for many, many LGBTIQ people globally. And this map depicts, it's not completely up to date, but the most recent that we have right now, it depicts where basically being gay is criminalized, where same-sex relations are criminalized. Currently, about 68 countries criminalize homosexuality, often in the form of so-called anti-sodomy laws. About 45 countries criminalize same-sex relations between women, and another more than 50, about 57, I think, countries criminalize being transgender in one form or another in laws such as gender impersonation or cross-dressing kinds of legislation. So this is a really important, I think, piece to keep in mind when we talk about the realities for people around the world. Next slide, please. In March, we decided that we needed to characterize how the pandemic, as it was emerging, how it was impacting our communities around the world, both the virus itself, but also the measures that were being taken very swiftly to contain the outbreaks that were occurring. We interviewed 59 people across 38 countries. We also conducted a literature review because we know, looking back at past disasters, crises, and emergencies, that our communities often fall through the cracks, whether inadvertently or in sometimes actually intentionally. So we wanted in real time to capture what was happening with our communities for the purposes of advocacy. It wasn't just for the sake of documentation, but everything that we do in the realm of research at Outright has the main goal of advocacy. And we really want to continue and are currently trying to get this information in front of agencies, humanitarian actors, governments, donors who are involved in pandemic response to argue forcefully for more inclusive response as the pandemic continues in different waves and at different paces to move across the world. Next slide, please. So this slide gives you a picture of who we interviewed. We tried very hard to ensure geographic diversity. Even though it was only 59 people, we tried and succeeded to represent most of the major regions to some degree around the world. In terms of diversity of respondents themselves, interviewees themselves, just under a third of our interviewees identified as gay or, identified as transgender. A little more than a third identified as gay or lesbian. And the remaining third or so identified as bisexual, queer, non-binary, gender non-conforming, maybe didn't specify. And then 3 among our respondents identified as intersex people. Next slide, please. In evaluating the stories, the narratives that we were able to collect over about a 2.5 week period at the end of March and early April, we were able to identify 7 clear themes that emerged. And in a minute, Kennedy and I are going to talk a little bit more in depth about a few of those themes, but just to quickly review, these themes were the most kind of dominant in the stories that we heard. So first of all, devastation of livelihoods and rising food insecurity, both in terms of the economic impact and job insecurity, that was part of what came out, but also difficulty in accessing food relief, for example. So availability didn't always equal access for LGBT people around the world. The next theme, disruptions in healthcare and medication access and reluctance to seek care. This really, we'll talk more about this theme, and I think it's actually fairly self-evident here. The next theme, elevated risk of family and domestic violence. Unfortunately, what has happened in this country and around the world is that with the lockdowns, the curfews, the quarantines, people have had to be sequestered in their homes, perhaps with an abusive partner, but for a lot of LGBT people, this might mean returning to their families of origin and having to live in an environment that was very unsupportive, that with family members who may not affirm their identity and preference for, for their identity. Increased isolation and anxiety, certainly, I think for many people, but for communities that already face a certain degree of isolation, for people who can't be out in various spheres of their lives, this isolation caused by the lockdowns of the pandemic can be quite devastating. I remember one quote of a woman from Kenya, a lesbian woman, who said that it felt like she was being cut off from the people who gave her hope. Another theme, concerns about elevated societal stigma, discrimination, violence, and scapegoating. So what this looks like is LGBT people being blamed for the pandemic because society is tolerating the sins of our communities, or that we are have too many partners, kind of along the lines of HIV, that our sexual promiscuity is somehow also helping to spread the virus. These are the kinds of narratives that people were hearing in their countries. Instances of state abuse of power, meaning that we have clear evidence that countries who are declaring states of emergency, for example, may be beyond what would be reasonable in terms of clamping down on populations. You look at a country like the Philippines that has militarized essentially its response to the pandemic. There are many, many examples around the world on that. And then finally, and I think very importantly, anxiety about organizational survival, where so many community-based organizations and advocacy organizations who are fighting on the front lines for human rights for LGBTIQ people are really in a very precarious position where they're not sure about funding, where they're not sure how they can respond to the immediate and emerging needs of their communities when they're hampered by the inability to physically move. And yet what we saw was an incredible also determination to help not only LGBT people, but also the broader society in terms of mobilizing food relief or access to medications. So quite inspiring. Next slide, please. So for the next few slides, Kennedy and I are going to just talk a little bit about, reflect a bit about what we heard in the various stories. It'll be a bit of an organic discussion, so the slides won't necessarily exactly match what we're saying, but I hope that you'll have a chance to just read through as we go, as well as hear a bit about what we're saying. So we're going to start with this theme of devastation of livelihoods and food insecurity. Because it was one of the most dominant themes. Interviewees described having to make very hard choices about whether to work for food and basic necessities versus protect themselves. So it's kind of a false choice, actually. And I think, you know, as Millicent Achieng here put it so eloquently from Kenya, that it's not so much that people don't want to adhere to the lockdown, but that they can't, otherwise they actually will not be able to feed themselves and their families. So I don't know, Kennedy, why don't maybe you could reflect a little bit on some of what you heard on this theme from the interviews that you conducted in the region.
Sorry, Amy, you are so right that in terms of concerns related to job loss and basic survival, you know, was a major theme that came across. I keep thinking about William Linares of Belize, you know, who shared with me his story that he has never been able to secure any other job than working at an LGBT organization, volunteering there sometimes when there are no funds, as well as an entertainer, a drag entertainer, because he says due to his effeminate presentation, no one wants to hire him. And he was feeling so secure that after many years of trying to secure an income, he had found a niche where he could survive. And the measures put in place due to COVID in Belize totally took all of these possibilities from livelihood from William. Mm-hmm. And so, you know, it reflects several of the other discussions that I had about concerns with job loss. Many times due to discrimination, it's very difficult to secure a job. And so when you finally feel that you have found some security in terms of your income, your livelihood, they feel that this has been taken away. Mm-hmm. We see the situation, you know, with the, as you said, the sex workers as well, having to risk going out, breaking curfew laws, other laws related to social distancing, because they need to eat, you know, they need to eat. And just like that, that's how they said it. We need to eat.
Yeah, exactly. And just before we move to the next slide, well, that's okay, we can move, but I just want to point out as well that even in places that were offering food support, it didn't actually necessarily mean that support was accessible to our communities. So for example, in Sri Lanka, where food was being provided through police stations in one part of Colombo, Sri Lanka is one of those countries where being gay is criminalized. And so that is not a safe place to access food. In other places like that photo in the previous slide in the Philippines, where the definition of family usually meant a heterosexual, cisgender family with kids. And so lesbian couples were being excluded from food disbursement. And I think moving now to the whole issue of healthcare, you know, I'm going to turn it over to Kennedy, but I just want to point out that we often say, well, it's not, we often say, it's actually a fact that those who have the worst outcomes related to COVID generally have pre-existing conditions. And for LGBTI people around the world, that pre-existing condition is violence, it's discrimination, stigma, exclusion. And so we're seeing now how that plays out in these very difficult times of lockdown. And we're seeing, for example, when it comes to healthcare, even in good times, so-called good times, the people were reluctant to go and seek care because they've faced discrimination in healthcare settings. They've not had their confidentiality respected. They've been misgendered. And so we heard stories of people really being quite reluctant to get care, even when they had symptoms of COVID. We also heard about disruptions in things like HIV medication. So Kennedy, I'm sure you heard some.
Yes, definitely. Major concerns about inability to access medications that they would normally be able to access monthly, for example, medication for HIV, a major concern. And I keep thinking about this young lady from Barbados, this lesbian person that said that she needs to acquire medication for anxiety.
Mm-hmm.
And she went to the clinic and there was so many things happening and no one was really listening to her. And when she tried to get a doctor's attention, the first question was, are you here for COVID? Do you have an issue with COVID? Do you suspect that you may have been infected? And she tried to explain why she was there. And they were just, if that's not the case, you need to get out of here, which of course added to her anxiety. So just imagine she's going there to access medication for anxiety and have to deal with that. And so definitely we see the disruption, in their access to medications. Like I said, for psychological issues as well as other HIV, diabetes, hypertension, all of these.
Yeah, and for transgender and intersex people who are relying on hormones, for example, we heard quite a lot about how hormone therapy and other gender-affirming care was deemed in COVID time as non-essential healthcare. And so they were being cut off to support that actually for them was quite essential. I guess we can go to the next slide. We've heard a lot about the elevated risk of domestic violence, I think, in all countries, certainly everywhere in the world. And much of what we hear is focused on intimate partner violence, with women being the primary sort of abused person in the relationship. As I mentioned earlier, I think also we need to be mindful of what it means to have to go back to unsupportive families. And this particular quote here is actually from someone in St. Lucia. But Kennedy, I'll turn it over to you also to comment on this. It's something you work on, I know.
Yes, I also had a long discussion with a young man who lives on an island where he does work in the tourism sector. And he has been comfortable because he has been away from home. He earns an income that he can send monies to his family. They don't know about his personal life on the island. But now, of course, because of COVID, all these hotels have had to close down. There's no tourism really taking place in the country because the airports are closed, everything is closed. And this person had to go back home. And he was terrified, that he would feel locked up in a home with a family that does not know of his sexual orientation. And so he felt like he was really regressing so many years, in his life, in his process as a gay man, having to go home to a home that he knows is very homophobic. He shared that he had an uncle that, that had come from another country, and that his dad and his uncle would only speak about, maricones being gay men and how they would shoot them in their heads and they would do everything. And sometimes he felt that they were speaking out loud so that he could hear it. You know, so even the self, you know,
Mhm.
the fear of being within this environment, all
Mhm.
because he had lost his very secure, what he thought was a secure job in the tourism sector.
Yeah, I mean, it really speaks to how many LGBT people have to form their own sort of chosen families and communities, and if that's been taken away from them, if they've literally been physically cut off from safe spaces and safe places where that's the one place they can truly be themselves. If they're denied that, then even just the psychological trauma and stress of that is quite profound. Next. So this last theme that we'll talk about more in depth is really core to really the global movement, in the sense that, as I mentioned earlier, we heard a lot about the anxiety that many activists and advocates were experiencing because of the uncertainty around what was going to happen with donors, their inability to carry out work that they'd already been funded to do, their inability to respond to some of the abuses and concerns about, for example, how police were behaving, or how the pandemic may be disproportionately affecting their community. They're having difficulty being visible, and I think Felicia Brown Acton here in this quote talks about the risk of becoming invisible. In fact, a colleague of ours has said that, you know, invisibility is worse than discrimination, because if you're discriminated against, at least you can fight back. So, Kennedy, I hand it to you for your
Yes,
reflections on this.
it's definitely a similar situation in Haiti, where Dominic, a trans man, shared concerns about being able to sustain the programs that they have just started to secure funding for, and not being able to meet, and having persons within the organization choosing to still meet in persons to go against the you know, the social distancing measures, because they're afraid that if they do not continue the work, that they will lose the funding.
Mhm.
So that, of course, is another major concern for many of our partners in the region and globally.
Yeah, and I think it's just important also for people to understand that many of the organizations that are really on the front lines of fueling movements at the country level, and most countries in the world actually have organizations that are fighting for the human rights of LGBT people, but they're not super well resourced. So they don't have the resilience in terms of funding to necessarily withstand the economic hit that so many organizations and individuals are facing with COVID. So this is why there's a great deal of anxiety about what COVID means for the long-term survival of movements going forward. I'm not going to go into these recommendations, but just to highlight the point, as I said earlier, that the reason we do this work, this kind of documentation and research, is to advocate for change. And so in this particular case, we are taking this report and its findings to humanitarian organizations, to donors, to other international NGOs, global health organizations, to really demand that responses need to be inclusive, that our communities cannot be left behind in the ways that has happened in the past. And so we encourage you, if you are within any of, Seattle has many international organizations, if you are working for them or know people who work for them and can take this message to those places, we would really appreciate it. It's how change happens. Thank you.
Thank you so much, Amy. And I just wanted to go in and speak a bit more about our work at Outright. At the same time as Outright launched our research, we also launched an emergency fund to provide assistance to grassroots LGBTIQ organizations, helping our communities around the world. We did this because we could see the huge need but also because we know that queer and trans people are often not reached or excluded from traditional or government relief efforts. Our fund supports Outright's COVID-19 response work and distributed grants to LGBTIQ organizations on the front line of responding to the pandemic. So far, we have raised more than $850,000 from more than 200 companies, foundations, and individuals, including Microsoft, Calvin Klein, the Channel Foundation, etc. We issued the applications on April 8th in 5 languages, and during our 3 weeks application period, we received almost 1,500 qualified applications from 141 countries, totaling a need of about $12 million. As you can see, we received requests from all over the world. The highest number were from Africa, the next largest from Latin America, and followed by Asia. We received 42 applications from Eastern Europe and Central Asia, from the Caribbean as well, the Middle East, North Africa, and from the Pacific. And the grants range from 2,500 to 10,000, and the average amount and grant size was about 7,500. Applicants served all segments of the LGBTIQ community. And so we want to just share with you that the requests speak clearly to an urgent humanitarian crisis among the most vulnerable LGBTIQ communities, as you can see from the diagrams that we share with you. In terms of the needs, the most common request was for assistance providing food. 57% of applications were for food assistance, 10% for shelter, 7% for healthcare, 9% for COVID prevention measures, including hygiene products as well, and 5% for organizational needs like Wi-Fi transportation. So very interestingly, our research reflects the reality that we found in the applications, which is very interesting. And overall, as you can see, the priority population served was general LGBTIQ, but there also are 17% of the organizations that serve specifically trans and non-binary persons. And of course, LBQ, 5%, MSM, 3%, and others, 6%. And so I just want to end up by saying that the overall graph that you see in front of you do reflect the realities of the research that the organization has also presented. And we have distributed 60 grants in 45 countries so far that are reaching about 20,000 people. Here are some of the organizations. We won't go through all of them, but we just wanted to share with you some of these. We know of the important work, for example, of Courage in Haiti that was greatly impacted just last year with the sudden death of a great activist who was the executive director, Charlotte Judy. And Courage presented an excellent sound proposal that we now know they are providing food and much needed supplies to their community in Haiti. Thank you. Katie will keep scrolling through the grantee slides. You don't have to read them.
Thanks, Kennedy. We just wanted to share a few examples of the photos and quotes from our grantees from different parts of the world. I think it's incredibly inspiring to see how our grantees and partners are stepping up to help our community, and how our friends in the Northwest and all over the world have contributed as well. So we wanted to just end by circling back to our theme. For us, our theme of Pride this year is Pride with a Purpose. And of course, Seattle Pride's theme of Together for Pride as we wrap up today. Hopefully you've enjoyed and learned something from our presentation. And I only wish that we could do a live question and answer to hear your thoughts and feedback. But you can follow up with us by reaching out to me anytime and by following Outright on social media or by signing up for our e-newsletter on our website. There are some other things you can do right now to help. As Ami said, we need help sharing our report and the research about what's happening to our communities around the world so that we're not invisible. You can also support and help us share our emergency fund with your networks. We are trying to get over the $1 million goal by the end of Pride Month, and you can help us by joining our Pride with a Purpose campaign. We also have a weekly webinar series with its hosted discussions on topics including conversion therapy, gender-based violence, and faith and advocacy. And you can watch or listen to Outright TV, which is our video and podcast series that features voices of LGBTIQ activists, friends, and colleagues from all over the world. And finally, we just want to ask you to support our partner organizations here in Seattle, especially those that are Black and or trans-led and work at the intersection of racial justice and human rights for the most marginalized in our community. So, just would like to end by thanking Kennedy and Ami for joining me today, and for Seattle Pride for your partnership and the invitation to share with our community here. We are so honored to be here. We're really honored to be a part of the fabric of the community here in Seattle, and we want to wish everyone a happy Pride. So thanks again, and take care.
Happy Pride. Thank you.